University of Texas at Austin right now. So we have a tentative date. I can't release that, but we have a date in our heads as to when we want to open. So we're pushing for that right now. We have started the whole process. They're working on, our contracted custodians are working on cleaning the facility top to bottom. We've secured enough supply chain for at least 60 days for PPE and disinfectant. We are working on getting in we have in all the handheld electrostatic cleaners. We're waiting on the hydrostatic cleaners at this point. We have started student staff training this week. I'm doing virtual trainings with them to kind of over some HR stuff and doing a safety review, because we know they haven't talked about CPR AED first aid for about 4 to 5 months at this point, or by the time we start. So we wanted to do a review of the safety certification stuff and the EAP. Then they go into in-person training where they're going to be doing some crossover training, because we're only going to start with 2 out of our 8 facilities open. So some of our indoor satellite staff, outdoor satellite staff, lifeguards might be working inside the buildings as well. So we've started all of that. We've started facility modifications, putting up our protective barriers, the plexiglass sneeze guards, installing more hand sanitizing stations. We're going from 4 to about 20 in our facility of hand sanitizing stations. We've started ingress, egress stuff. So we've really started overhauling everything to try to hit that date we have in mind, like end of July is what we're hoping.
So kind of just moving on from there a little bit, Davida mentioned, a soft reopening. We've talked about phases in the past, so whatever kind of phrasing that we want to use for it. Anyone that either has opened and is kind of working themselves through the phases, or those of you that are in discussion about formalizing some of these things, what have been your phases? What's part of your soft reopening? How much time are you spending in each phase? What's that look like for your respective departments and institutions? Come on, guys, you were talking all about the phases that you were doing. I'm gonna start calling on people.
I'll go ahead and talk. I'm from UCLA, for those that don't know me. We don't have a date. We have a date in the back of our mind that I think we're all working off of. Our phases are kind of, we're looking at opening selected outdoor facilities first. California is still very active. We have no idea if things are going to change. Gyms are open in the state of California and Los Angeles County, but our campus still remains closed. However, athletics was allowed back on campus last week, or football was allowed back on campus for their beginning of their phases. So we're kind of working off of a similar phase of them. So we've got selected spaces, outdoor spaces that will open, our track, our IM fields, that both have probably 100 people a day at least breaking in. So our thought is kind of, at least let's get those open and monitor them. And then our tennis courts. After that, we'll slowly phase into the possibility of opening our pools and our indoor facility.
And Stacy, you guys don't start school until after Labor Day, right?
Correct. We start at the end of September. So we're on quarter system. So yeah, we don't start until the end of September. And right now the university has all summer classes are remote. So we don't have any students on campus. And then for the fall, we actually only have about 15% that are going to be on campus of classes. Most of them will be off campus, and they've cut the number of students down on campus, I think by half. I think they said it's about 6,300 will live on our main campus and 1,700 will live in like university owned off-campus housing.
Anyone else care to share any of their phases or what, their soft reopenings are, any time frame between some of those different things?
One thing that I found helpful at Nebraska when we've reopened is our city county health department has a risk dial with different degrees. So your green, yellow, orange, and red. And then they have a matrix that goes along with that, that as long as the risk dial is in yellow, this is what happens in businesses. When it drops to green, this is what happens. So we've tried to emulate that a little bit with what's happening within our facilities as well. So as you talk about outdoor spaces, we've coincided that with Lincoln Parks and Recreation. So we're doing very similar things, but I think where that's been most helpful is to our student staff that, okay, as long as this dial stays in the yellow, this is what you should expect from us as an employer. If it pops back up to orange, this is what we're going to have to take back offline. Or if it drops down to green, this is what we're going to be able to add back. Because that's been our hardest question all along with phases, and the piece of that is, when will you know? How will you know? So if you have that resource in your community, I would encourage you to check that out. And so instead of us having to say we're on phase 2 or we're on phase 3, we're able to say we're doing things that follow the risk dial in yellow. So.
Anyone else got anything they'd like to share?
Hi, Therese Kennedy, UW Whitewater. I'm having a bad hair day, so no video. We are a shared facility, and we're looking at an opening of August 1st. Our EOC on campus, we're determining, and I'm on a subcommittee of that, determining numbers. And so our football team, we're planning on bringing back, and being a shared facility, it's kind of hard to say, all right, we'll let them do it, but the other students can't. So we're working on what those numbers look like. Again, getting our hand sanitizer stations, getting our plexiglass put up. And our facility, actually, the university, we're in 2 different counties. So the one county has a different thing than the other county. So the campus is coming up with what they consider numbers or what that looks like. And the campus is doing signage. And so obviously we're going to do what the safety of our students and staff comes first.
Thanks, Therese. So, for those of us that either have opened or have really started to operationalize what our reopening is going to look like, please feel free to share what you think has gone well, what you're like, well, I'm glad we really did that, or, that worked out, better than we thought it would, those kinds of things. And then if there's still some challenges or some questions out there that you're like, man, I like this part of our plan, but I don't know how we will operationalize it, or things of that nature. So getting down a few more into the details of all these things that we're working through, or, again, if you just have a question of what's everyone doing with, how you approaching something in that regard. So I guess one of the things maybe we could talk about is, and not trying to politicize this topic at all, but the whole idea of masks and what that looks like on your campuses. I know we've had conversations in our department about, really just wanting to follow the lead of what campus sets as an expectation, and then how do we best position our students to help enforce that, because, like it or not, we've all seen, and regardless of where any of us falls on the spectrum of the mask wearing, we've seen that be a pretty hotly debated topic. And I think regardless of where any of us are at, we know that there's pockets of our members that are going to feel strongly on both ends of the spectrum, because, we were thinking about that yesterday is, what if someone feels very strongly about not wearing one, and then they're on a machine that's maybe not right next to, because I think we've all adopted, spacing things out, but, someone that feels very strongly about wearing them, and how do we help manage that? So, what are different, if you've decided on a policy, what is that? How are you justifying that, or helping to train around that? And then just maybe even just the different conversations that your departments or institutions have had about masks.
I can tell you, University of Texas at Austin, they made the decision for us. If you are inside a building on campus, you have to wear a mask, and they're even including working out into that. So they have to wear a mask when they're cardio, weightlifting. The only thing that they're going to allow no mask for is swimming. So if you are inside a facility, doesn't matter the facility, doesn't matter rec sports, you're wearing a mask. So that we are following those protocols, and we're training our staff. I don't know how many people have seen the new psychological first aid training that American Red Cross has put out. It really helps people who take it understand stressors and being able to recognize stress or things like that in people, and how to help calm down and how to de-escalate situations. And we're using that training to help guide us in having those conversations with our students. So our students can see, like, maybe it's the stress of everything that this person is going through, and how can I help them? So we're using that training to help us, to help guide our training with our students.
Where's everyone else landing with the masks, or what have been some topics of discussion? So Stacy shared that Los Angeles County, you know, anytime you're outside your home, whether you're inside or outside of a space outside your home, that's what they require. I know in the state of Illinois right now, it's the same. Basically, they're a little, I think it's more strongly encouraged if you're not indoors, but required if you're going to be indoors. So again, we're trying to figure out what campus's determinations are going to be, and then how we work that into our systems here when we reopen. Amy, where's Nebraska at with their masks?
So we were at a bit of a challenge. As I said, we reopened on Monday, June 15th. Our overall forward to fall group did not have a face covering policy in place until June 17th. And so we set a lot of things for ourselves because there just wasn't anything there. So right now, ours is mandatory if you are on campus for staff and then visitors to campus. It also includes third-party providers. So through our procurement office, if you are a contractor or a UPS driver, you know, whomever that may be, you do have to have a face covering. Exemptions include when you're eating, but you still must maintain social distancing. And then specifically within the recreation center, if you are physically exerting yourself, you do not have to have the face covering on if you can continue to maintain that 6 feet of social distancing. So for us right now, if you're on an elliptical, that's because we've moved everything that 6 feet of spacing away, you do not have to wear it, but if you're able to, we encourage you to do so. But if you are playing outdoor ultimate, because ours actually goes for outside as well, and cannot maintain that 6 feet of spacing, then you do have to have it on. And so we're, you know, a week into it. One of the things that we've done right now is we have disposable masks that we're providing to people at the door if they do not have their own, and encourage. But we have taken a very similar stance as Erin was talking about in training our students. Is it's not a negative piece of you have to do this and you're going to be in trouble if you do not. It's the other way with Huskers helping other Huskers be healthy. And so what can we do in regards to a social responsibility of you personally protecting those within the community by wearing the face covering? And then also really going with this is not something, again, that hopefully you have to do for the rest of your life, but if we all make a concerted effort right now, we'll be able to diminish the amount of time that we need to wear these if we're able to get this under control. So right now, we are not refusing service. We have not started that yet just because we're one of the only entities on campus that is open. So it's education. If they come in without one, we ask if they've had one in the car, could they go back and get it? If they say no, we say, well, great, we have one for you. Go ahead and put that on. I've been super pleased. Most everybody has said, sure, thanks, I appreciate that. And so It really has come down to that education. We haven't had the incident yet where somebody has been in confrontation with any of our employees that they're not going to do it. For our staff employees, because it is required, we have allowed either the cotton face covering or a plastic face shield. We have definitely gone to face shields in some of our other environments too, in case there's a hearing impairment or something of that nature, because that's one part of our face covering policy, is to realize that there are some populations that this causes anxiety for them. This is very stressful. And so we're trying to figure out ways to still have the barrier there, but not only say, so the only requirement with our face covering too is that it goes from the bridge of the nose to below the chin. So however you achieve that is completely open to you.
So for those that do have the mask required, getting into a little more of the specifics of how are you or do you plan to enforce that? And then, you know, have you talked about how you might approach it if someone gets more confrontational about it, you know, refuses to put one on, or, you know, even refuses to leave at that point? Has anyone either experienced that right now or kind of talk through about what that could look like? Or I know a few of you have mentioned in the comments that they're required on your campus. So have you gotten guidance from campus about how you might best enforce that, or what, you know, support pieces are there if you run into issues with it? So I know we're all still waiting on a lot of details, and we still have way more questions than answers. I know our campus right now is leaning towards faculty and staff, and that includes, you know, any part-time student staff you have are required to wear one at all times. But I think I saw the language in the chat somewhere was the strongly encouraged. But again, if you have someone that feels really strongly about wearing a mask and someone doesn't have one on, you know, we still have to have those conversations between our members and help manage that piece of it. Dwayne brings up a good point that we've talked about a little bit previously, and maybe you all have a little more specifics about it, but is anyone instituting any kind of screening at the door? Is it more, you know, a passive sign that says, by entering, I acknowledge that I haven't been exhibiting any of these symptoms, haven't been around, you know, anyone that has, those kinds of things? So is anyone planning on implementing any, you know, whether it's screening, temperature checks? I know we've been, you know, again, like a lot of this stuff, we're all on all ends of the spectrum with it, but if anyone could share any screening that they're doing in their facilities or their campus is doing, that would be great.
Hi, this is Brandi with Loyola Chicago. Currently what we're doing is we have a 24-hour in advance reservation sign up, and in that reservation sign up, they're prompted to answer screening questions released by the Illinois Department of Health. We haven't tested it, we're not currently open, but that is what we're thinking right now. We'd love to hear other ideas though.
This is Brad from Colorado School of Mines. We're not open yet, but one of the things that we've talked about doing is we have the sneeze guard glass partition at our front desk, and we've talked about putting the typing the questions up and taping them to the glass, and then asking people, do you exhibit any of these symptoms? Along with the temperature check. That's something our administration has told us we need to do, but we figured that would make it that we have to ask patrons one question as opposed to have to asking them 6 or 7 or 8, however many, is deemed, to be read. We think that asking them to read the questions would be faster and more efficient. But I don't know if anyone has any thoughts on that, but that's what we're toying with at this point.
We're going to be using, Fusion for people to pre-register for their time slot to come in to work out. That will involve some sort of waiver that they are not experiencing any symptoms. They will not come to their book time if they do start to experience symptoms. And then they'll have to check in and they'll get asked very quickly, do you have any symptoms? Have you been anywhere where there's a hot spot? So that's how we're tackling it.
I saw that Amanda posted in the chat too from Seattle U, and we have something very similar at Nebraska that the Med Center developed, and it's One Check COVID app, and you answer a series of questions, and if you get a green, you should come to campus. If you don't get a green, you should not. And so they have based all of their narratives off of that app, and encourage people to do so. And that is our main sign that we have prior to our front entry points is a giant poster that basically says stop, and then it has 3 symptoms listed there. If you have any of these things, please go back home. And so that's kind of our, before you even come into the building, education piece that's in place to, again, educate people, let them know that we are open, but we would really prefer you not to come in here if you have one of these items.
Similarly to Seattle, our campus is developing an app as well. I don't believe it's live yet, to where there, you indicate each day before you go to class or before you go to a facility. But it's my understanding, I think this is one of the things they're still trying to work through, and I don't know if they'll really ever get over the hump of it, is they'd like to be able to use it for contact tracing if needed. So if you you can't require people to download this app, but if you voluntarily download the app and then either yourself happen to test positive at some point, or, and this is really the big rub of it, is it would use the location tracking services on your phone to monitor where you are at, so it could tell you if you were in proximity of someone that tested positive. So again, in today's age, obviously there's pros and cons to this, but I think that's the biggest thing that they're trying to still navigate is how you kind of get students and staff to buy into this when it is, very apprehensive for some people to download something with it's going to be tracking your location pretty constantly. So I don't know exactly where we're at with that yet, but I believe they intend to launch it in some capacity before students come back in August.
UT has something very similar as well. It's not exactly an app. It's just a link or a QR code that people can go to fill it out, and they have to fill it out before coming to campus that day, very similar to everybody else. We are also doing something with internally with our students that have to come to work that day. They have to, not only do they have to do the UT one, but they also have to do the rec sports one if they're working that day. And it's linked to all of our internal services. We have a very homegrown system. We don't use Fusion or anything like that. And an alert is sent to a supervisor if somebody answers one of the questions. Yes, I feel like I had a headache today, or I was coughing today. And so we then have to go through the OHP process, which is our occupational health promotion office on campus, and start the process with them in regards to having symptoms and all of that fun stuff. So, and if they get that, if we get the alert, they also get a letter from our HR, an email from our HR that says, you said you had a symptom, here's what you need to do to be able to come back to work.
Erin, when that happens, are you, more or less excusing someone from like the student development, student HR standpoint of that with any upcoming shifts? How are you guys managing that piece of it?
Yeah, that's, we're overstaffing. We're overstaffing by 1 or 2 people every day, just in case things like this happen. So we will always be able to find things for them to do. It's not true overstaffing, but you know what I mean, just in case. And they are, once they say they have some sort of symptom, they are out for at least 3 days. And again, this is university policy. This is not policy that recreational sports has put up.
So then assuming that they're excused from their shifts, there's no penalty in that regard. Otherwise it would be, that kind of goes against the point of trying to get people to be truthful.
Exactly, correct.
That comment, Jess, is one thing I wanted to make a little note about. We talked earlier, when people were talking about reservation systems and kind of that 3 strike you're out or what that looks like. One thing that we learned from that experience, or as we were planning our reopening, that we took a pause on and pivoted and changed, is that we do have a reservation system for our strength training conditioning areas that we had to monitor a little bit more closely and restrict the number of people in order to maintain the social distancing. And so we talked about, okay, what do we do with the no-shows? Should they be penalized? And we went the opposite direction with that, because first and foremost, we were like, yep, they don't get another one. This is how we're going to handle it. But we don't want those individuals in the building if they're not feeling well. And so that was one of our things that we removed after talking through that more, is we didn't want someone to show up to one of their workout reservations and think that they were going to lose out on privileges later because they weren't feeling well at that time. And so if you're considering that, I would encourage you to revisit it and maybe talk that through as a staff again, as to kind of what that negative connotation may have to somebody. Well, oh, I'm not really feeling well, but I don't want them to take away my reservation slot, so I better show up, and just kind of think about that one. So
yeah, it's definitely a balance of, you know, not wanting to, knowing that space is obviously limited, and not wanting to take an opportunity from someone, but again, not wanting to incentivize someone being scared to tell, you know, not be truthful because of what's going on. So you know, since it's come up a couple of times, let's talk a little bit about these different reservation systems. So I know people are using Fusion, you know, Texas has its own thing going on, but if there's different things that you all are using for that, and then how are you, obviously our facilities dictate how we're able to manage this to, you know, to a pretty good extent. But once someone comes in, how are you making sure they don't stay for longer? How are you, you know, if you don't have a space that's easily able to maintain numbers in, if there's like a lot of different ways that people can get down to a certain floor or things like that, how are you managing those things? So anyone that's doing a reservation system that's been open, or has at least talked through how they're going to try and manage these things, I think, you know, there's quite a few people, including myself, not selfishly doing this as one of the moderators, just interested in how that's going and how you've gone about thinking through those things. So who all said they were doing just a reservation system? I know there's a good amount on here that I think I've seen. Amy, do you guys have, you said you had a reservation system,
yep.
Right?
I try to count to 10, see if anybody else wants to jump off mute there. We do, and we still are a rec track school. So we use Vermont systems for ours. And right now we do not have reservations everywhere within the facilities. We have them on the first floor of our smaller facility on our East Campus, and then we have them in our strength training conditioning room in the main campus rec center. And then we will be adding next phase, starting next Monday, our pool. So we will be adding pool reservations for lanes on that. And then we will also be opening up our climbing center next week. And so we're adding reservation times for that. The way that we handle it in the reserved areas is they're for 50-minute blocks. And then those areas are actually able to be cleared by our staff. So they clear the space, and then they spend the next 10 minutes cleaning. And then the next wave of individuals comes in. The way that we have that set up is that they have an iPad in the area that they're at, and they pull up the roster through the web track, and then they're able to check people off. At 10 minutes past the hour, if we haven't reached capacity, they allow walk-ups into those spaces until we reach the capacity for that location. And it has gone very well. We found that, again, the first 2 days that we were open, we had a designated student staff member that was really good with the web-based reservation piece on people's phone, and they kind of stood at the front and helped those individuals that were coming in that tried to make their online reservations, but it was user error where they were having the challenges, so that we could do a little bit of a tutorial for those individuals. And that's where we really had our biggest stumbling block. We also have it set up that the next day's reservations don't go live until noon the day before. And so that gets people actively engaged kind of in that questionnaire of, hey, how do you feel? You feel good? Go ahead and make your reservation. We also take reservations because we are doing group fitness classes at a limited basis. What we did in there is in any of our group fitness space, we did a honeycomb tape on the floor. And so when you come into that fitness class, you get your 6x6 honeycomb, actually it's 10x10 is how it works out, but you get your honeycomb space. And so we reserve to those areas. We do not allow walk-ins into that particular program area, just because of the equipment and how they clean that and how that works. So they know that they need to prepare for X number of participants at that time. So, a couple of tweaks here and there, but it's gone very, very well. Again, there's the web track basic method, and most people are doing them through their phones. And then we probably have that walk up piece, but we're also at the benefit where we have two different facilities. So one of our facilities is open from 6 a.m. to 2 p.m. The other facility is open from 2 p.m. to 10 p.m. So you can get a reservation anytime from 6 a.m. to 10, but then that allows us to control the numbers and control the cleaning between the two buildings.
Thanks, Amy. Anyone else care to share just what they're doing? And it doesn't have to be finalized yet, but you know, if you're approaching that and kind of the legwork that you've done to establish that, how you've talked through it. If anyone's doing signups, you know, I know Fusion's a popular one. Amy mentioned RecTrack, WebTrack. Is anyone else using any other system, whether sophisticated or not, that if people don't have access to one of those two softwares or something else, is anyone using just a different system to manage signups in any way, shape, or form?
I heard some people were using IM Leagues. That was one platform I heard as well.
Anyone else using anything other than, I guess, those three at this point?
This is Cyrus from UVM. So we're a RecTrack school as well, and sort of tried researching setting that up for the reservations, and I've also been working with IM Leagues to try to figure out how that would compare. And there are a few features in IM Leagues that we really liked that we couldn't figure out in RecTrack, such as people can enroll on a wait list and then automatically be added to the class if somebody else pulls out, excuse me, as opposed to having to manage that, you know, with our staff, which was a really nice feature. So we're sort of weighing the two right now and trying to figure out what would make most sense for us.
Thanks, Cyrus. Anyone else share their thought process, what they're working through? I know for us at Illinois, we're still trying to decide what it is that we're even going to do. Our facility is really large, and it's been a renovation and expansion. So there's a lot of hidden stairwells and such that we can't close off for obviously fire code and various other purposes. So fortunately, most of our members don't use these, but again, just trying to manage like what could that look like. There's probably 6 or 7 different stairwells that you could take to get down to our lower level where all of our strength equipment and racquetball courts are. So, you know, we can't pay 6 staff just to stand at a door like a bouncer. So how are we managing that? And I like, you know, to Amy's point, I like the idea, because our biggest thing, how do we clear a space? How do we make sure, you know, I was thinking of the wristbands you get at a trampoline park kind of thing, but we're not necessarily operating in that same type of environment either. So, you know, we're still very much working through these things. Dwayne has asked, you know, are schools doing total capacity or having people sign up for different spaces? So Dwayne, just to make sure I'm interpreting this correctly, and I think we're dealing with this as well at Illinois, is, you know, are you doing a total capacity of the facility, or does each space have its own capacity? Is that what you mean, Dwayne?
Yeah, we have different, like we have 2 different cardio rooms, 3 different weight rooms. So I'm just wondering if people are getting down to the nitty gritty of signing up for cardio zone 1, signing up for weight room 3, or are you just doing total building capacity and then it's a rush for get in the room?
We're doing it based on the space. So we have 2 different weight rooms in our facility, and we're doing it based on the capacity of that weight room. So they only sign up for the weight room, but we're allowing other people into the facility to sit at a table and chair, go to play. We're allowing 1-person racquetball and stuff like that. So they have to sign up if they want to get into a weight room space, but they don't have to sign up just to come into the facility.
Ours is very similar to Texas. We have that same piece, that those areas that we knew would be high demand, that we were going to have a problem with capacity limits and queuing down the hallways, those are within the reserved area. But, you know, we have several racquetball courts that have been turned over to cardio zones. And so rather than there being 16 pieces of equipment in there, now there's 6. And so, and they're socially distanced and spaced. And while we still monitor and go through on an hourly basis and clean those areas, that's a first come, first serve. You don't have to do a reservation. You can just show up and go use one of those pieces of cardio equipment.
Anyone else care to share what they're doing or have talked about doing as it relates to the capacity piece? All right, so shifting gears a little bit, Erin mentioned what they're doing from a staff training perspective, but, you know, interested in what you're doing to get your staff back up to speed, whether that's just your general policies and procedures, all the new policies and procedures getting everyone back recertified as they need to be, that, you know, meets department or institution or state standards, that you've had, you know, just repopulating a staff that, you know, you haven't had to have a building operational for 4 to 5 months. So what's what do those things look like? So anything as it relates to your part-time staff training and how you're going about bringing that all back on board.
So we've been talking, and in order to open more, we're going to be good to open during phase 1, but to move on to phase 2, we are definitely going to have to hire. And as of right now, we have not been given approval to hire more students. So we're still waiting on that approval. And we really actually, if we want to open more facilities by the start of the school year, which is the last week in August, we needed to start the recruitment, hiring, and all that fun stuff like 2 weeks ago. So we're kind of playing catch up right now and trying to think about how are we going to, like exactly what Jess said. So we need to hire at least 100 students in facility operations to get to full, to get to our phase 3, which I'm not saying we're getting there at any point soon, but in order to go to phase 3, which is everything's open, everything's good, we need to hire 100 students. And how do we get 100 students certified? And that we're really working through that right now. And like we only have, I want to say like 6 or 7 LGIs right now. So how do we make certification instructors? So how do we make this happen? So I don't have any answers for anybody right now. I know blended learning is going to be like 100% of it most likely, but that's kind of, we know we're behind the ball right now for fall, and that makes us nervous. I don't know if anybody else is in that position.
I mean, I would say at Illinois, we're in a similar position, maybe perhaps a little bit behind, if that makes anyone feel any better. We had, I mean, prior to all this happening, we had only done just the normal certification class. And we had started to implement the blended learning and then recertifications just to help save our budget anyways. So we're going to bring that back as quickly as we can, just again, to save time. You know, blended learning for a lot of different reasons is just the norm anymore. So we'll have that. And then just this past week, we've been asking the direct supervisors of our different areas to We have, you know, an internal house-grown part-time employee database where you list certification status in. So we've asked all supervisors to go into that and look up all their staff when their certifications expired, and then our risk management staff members compiling that all into one document for he and I to look at and kind of just really get a hold on what we're dealing with and how we're going to have to manage that. And then, you know, we're likely going to have to prioritize, okay, you know, we typically have all these different positions that have a certification, but that's just not possible for us to do right now. So how do we prioritize and, to a certain extent, handpick who gets priority over the different classes that we're able to offer? So that's kind of where we're at right now with the certification piece. There's a bloodborne pathogen certification that's required on our campus as well. But if you've already taken the live class once, which you have to as part of your orientation when you're a new employee, then there's an online recertification. So that's pretty easy for us to accommodate, but we're just now trying to gather the info to get a grasp on our certifications and who's expired and who will be expiring and those kinds of things to see what we need to do for the beginning of the semester. And we have about 600 to 700 student employees. We probably certify 500 to 550 of those. So it will be a lot to work through. Is anyone else doing anything virtual like Erin mentioned, as far as, you know, remember, these are our policies and procedures, or introducing them to, you know, what you're going to come back to is going to look different. Here's some things to start familiarize yourself with that. Any, you know, staff training pieces that people have been working on, maybe you haven't even implemented it yet, but it's been on your desk as something you've been working towards.
One of the benefits that we had through our environmental health and safety office is they did an online training for COVID-19, what is it, awareness training. And they made that available to all staff, including student staff. And so for our managers type level individuals, while we were trying to facilitate something of our own, we enrolled them all in that class through EHS. So that was very helpful to us because, again, trying to plan and do our own within the time frame and the time limits that we had. So we will continue to do that. But again, I would encourage schools to look out to their environmental health and safety, because they may have something created that wouldn't normally be offered to student employees, maybe just benefit eligible employees, but they made an exception for us and it's been going very well. So.
And Max just brought it up again in the comments, but he attached a free, or a link to the free psychological first aid supporting yourself and others. So I know I had written that down to look up. So thanks, Max, for doing that and dumping that in the comments for us. But I think that's a great early resource. I know there's just a lot for all of us to figure out, and it's overwhelming to even figure out where to start.
And just FYI, it's not like all the other trainings. There's no videos. It's a click through. It's it took me around an hour to get through, but I definitely pulled a lot of information from it for our trainings.
Anyone else want to share what they're doing with their staff trainings? Okay, thought we could spend the last 10 minutes or so hopefully talking about just cleaning. So, you know, I know we've talked about this a lot. Hopefully those of you that ordered your hydrostatic or various cleaning systems at the beginning of the summer are starting to get those in hand. But if you're, you know, have started to drill down into some specifics of what perhaps your custodial or building service worker staff is doing versus your student staff, if you're scheduling, you know, 2 to 3 additional staff per shift to clean, just, you know, any insight on how your individual institutions are handling the higher level of cleaning that's just going to have to become our norm.
So our new contract with our custodial services, they're upping their game a little bit. They're going to be, in the past, they hadn't really restocked restrooms or restocked soap dispensers, hand sanitizers. We've put that all on the students before, but now we've written that into the contract for the custodial company. So they're bumping up their service during the day. They're hitting the high touch points more. They're making sure that all of our hand sanitizing stations are full, our soap dispensers are full, they're cleaning the restrooms more often, they're restocking the restrooms. We're going to have the students focus more on the equipment and like the weight rooms. We've gotten the handheld electrostatic cleaners. It kind of looks like a dust buster. So they're going to be focusing on those. We've also gotten the hydrostatic cleaners that will do overnight, and the custodial staff will be doing those. So we're just bumping stuff up just a lot bit. So that's kind of how we're separating that stuff.
I'd say at Illinois, we're still very much developing this. We have purchased a couple of the larger hydrostatic cleaners that, similar to Texas, our custodial staff will be using of an evening. And then we have some of the handheld ones that we bought for our various facilities for student staff to use, since it's a little easier to kind of navigate spaces with those things, especially when people are in them. So we haven't developed an exact plan about what how our student staff's usage of that will work. We have started to talk about, we operate the ice arena on campus, and obviously a big part of that is the skate check for, you know, a lot of people that come to especially our public skate sessions or our learn to skate lessons don't have their own ice skates. So that's obviously a huge piece of how could we manage that. So we've talked about that before any public skate or learn to skate session would start, our students would go in there and do the hydrostatic beforehand, and then they still manually spray disinfectant in the skates when we get them back. And then at the end of every one of those sessions, all the skates are sprayed again. So in theory, they're getting disinfected twice before they're ever used, again, kind of thing. But even to that point, all of our initial reopening things, we're not doing any kind of equipment checkout. So if we do skate check, it's going to be a few months down the road, kind of thing, as well as right now our language is until further notice. Like, we haven't determined what that point in time is yet, but it's not going to be any part of the initial piece of it.
Yeah, our equipment checkout right now is limited to racket sports that we're allowing solo play and hard surfaces that we're able to clean. So the badminton racket, the racquetball racket, that we can take care of. And we've been utilizing then Connect 2 on the checkpoints, and we've had some student staff positions that normally would not round through the building or do other things. But between what we did is asked all of the service areas to look at their student staffing patterns, and we have a rover position that's pretty much going through. And, you know, so there's really somebody going into each space, 15-minute, half hour, 45, you know, that's wiping down and checking on things and doing different pieces, because we are still waiting for our hydrostatic sprayers to be here. But we also were very, very fortunate to have our innovation campus produce hand sanitizer and a disinfectant that's readily available to us. So we've been able to switch all of that over, but definitely have increased the amount of student travel and the protocol for them as to what that position looks like. It's really turned into kind of a sanitation specialist. So,
such a fun term. Anyone else with info to share about their various cleaning practices, what they've talked about doing as a department? Okay, well, to backtrack a little bit to some usage pieces, Rusty's asked, for those of us that have indoor track spaces, I know, you know, there's some that are 4 or 5 lanes, so it's a little easier to monitor. Ours, I know here, only have 3. So are you allowing usage of that? How are you maintaining social distance? What does that look like for those of us that, you know, kind of where are we landing? Is that a later phase? Just where's everyone landing if you happen to have an indoor track in any of your facilities?
We took the language from Texas A&M, and basically you get to be in the inside lane, socially distanced 6 feet apart. Outside lanes are for passing. Again, we've only been open 2 weeks. We just haven't seen the volume of people in the building where this has been a problem. So I'm sure we'll probably have to reevaluate that or look at that differently maybe as more people start to come onto campus. But right now we have signage posted and that's worked for us. So.
Anyone else with info on how they've used their tracks? All right, Gillian, I'm gonna let you ask your question or ask for guidance on that just to make sure that I capture everything and all those specifics that you included.
Yeah, so I just didn't know if people had like any guidance on the ventilation in their buildings. I know, so we're trying to figure out how to open our indoor spaces, our fitness center. And I know I work at a small college, Division III college, Williams College in Massachusetts. And I know our facilities department has gone through and checked like the HVAC and ventilation in all the spaces across campus. And they figured out in classrooms how to socially distance people based on the air circulation in those buildings, but we weren't really sure how it would work in like a basketball gym or a fitness center because, you know, how much people would be exerting themselves. So I didn't know if anyone had any information. The state of Massachusetts hasn't come out with anything yet, but we're trying to have our facilities department check the HVAC in those spaces. I don't know if that made sense.
Yeah, I think I would echo. So Dwayne put a comment in the chat, and I would say the state of Illinois is more where Dwayne's at, and I think that's where a lot of the standards that you've even seen shared nationally as far as maximizing fresh air coming in, you know, minimize recirculation of air as much as you can. And so I think some of that comes back to even just determining the efficiency of the systems in your facility and what that load is, because it's going to take more to bring in fresh air and cool it or, you know, heat it when we get later in the year, as opposed to just recirculating air that's already close to whatever temperature your systems are set at. So I think the efficiency of those systems is key. So that could be a better way to approach what you're talking about if you can't get a specific answer to those things, but just trying to hone in on how efficient they are, and then asking that, you know, that recirculating versus bringing in fresh air. And, you know, he did mention that there is an extra cost to that because, again, the extra cooling or, like I said, heating when you get later in the year will make a difference cost-wise.
Yeah, and the big thing we looked at Texas was the humidity rates. While we could cool the air, the humidity rates in the facility were just through the roof, and that was what was affecting us the most. So we were supposed to open up more to outside air, but they've allowed for us to stay at more recirculated air just because of the humidity levels. One thing that you can look at, and I don't know if this is the MERV count on your filters and what those are at. And we have talked about upping the MERV count in our in our administrative suites, just to help get some of the finer particles. So that may be something you can look at as well.
And I just copied and pasted the last paragraph of our building document into the chat too, where it talks from the ASHRAE article and the BOMA article. Very, very similar again to Texas. We had the conversation with, you know, your physical plants, your facilities on campus in regards to ours when we were reassessing which those HVAC settings would be. And so we basically said, you know, from ACSM guidance for a court space. This is the relative humidity we want. This is the temperature we want. What can we do on the fresh air exchanges to maintain that ACSM, and what can you do for us in regards to that? It's been different for all 3 of our facilities based on when they were constructed and the type of air handling unit that were in those. So we had a lot more flexibility with the building that was done in 2014 than this building that was done in 1989. And so it was having a meeting with the utilities controls and sitting down and working through that with them. We did some filter replacement too, and went up to like a MERV 13 or something like that in some of our areas. But we talked through those points, but then we were really, I guess, steadfast in the, hey, we don't want these humidity levels to be this for our Maple Court. How can we achieve this? What can we do in order to make that happen? So it was a couple meetings, couple conversations, but it has gone well. So.
All right, we got about a minute left. Any last questions anyone wants to ask? All right, well, thank you all for joining us today, for participating. We'll likely schedule another one of these, to be determined, probably in at least a month, just because we know that as much as things change, we still don't know a lot, so that can be challenging to engage in the conversations, and we just don't know a lot yet. And then just a quick shout out for the reopening conversation. That group from NIRSA is hosting a webinar roundtable. I think probably more of a webinar. I'm messing up the word, so Christine can, she's used to me just kind of making stuff up. But they are hosting a webinar about all the information that's been sent out about that at 11 a.m. Pacific, which is 1 p.m. Central. And hopefully you can do the rest of the time zone math from there for you, but lots of great resources. I know sometimes it's overwhelming. Sometimes I have to just monitor how much I'm taking in, because it does just get too overwhelming for me. But if you're looking for more things, maybe specific to NIRSA and Campus Rec, would definitely encourage to sign up for that webinar, which you still can, or just continue to look for the resources that are available online to us as well. So thank you all again. I sincerely hope you're all well and you're navigating through all these things as well as you can. So everyone, have a good 4th of July weekend.